Welcome to this tutorial on diet and nutrition, brought to you by Medical Biochemistry Power Capsule series. This video covers the following CBME curriculum topics: discuss the importance of various dietary components and explain importance of dietary fiber. Summarize the nutritional importance of commonly used items of food including fruits and vegetables, macromolecules and their importance. Nutrition is the science of how food affects our bodies and overall health. It involves studying nutrients and how our bodies use them. Nutrients are substances that provide energy, help with growth, repair tissues, and regulate body processes. Good nutrition is critical for maintaining health, preventing diseases, and supporting recovery. Nutrition as a medical discipline focuses on the study of nutrients in food, their functions in the body, and their impact on health and disease. It's a multidisciplinary field that intersects with physiology, biochemistry, medicine, public health, and behavioral sciences. Nutrition studies the biochemical and physiological processes by which the body uses nutrients to support life and health. It encompasses the intake of food, digestion, absorption, metabolism, storage, and excretion of nutrients. Dietetics is the science and art of applying nutrition knowledge to promote health, manage diseases, and prevent nutrition-related disorders. It involves translating nutritional science into practical dietary recommendations and interventions to meet the needs of individuals or groups. Macronutrients are the nutrients required in large quantities. Carbohydrates are the body's primary source of energy. They include sugars, starches, and fibers found in fruits, vegetables, grains, and legumes. The body breaks them down into glucose, which fuels cells, especially in the brain and muscles. Proteins are composed of amino acids and are essential for building and repairing tissues, producing enzymes, hormones, and other body chemicals. Good sources include meats, dairy products, eggs, legumes, and nuts. Fats are often viewed with skepticism, but fats are crucial for energy storage, hormone production, and protecting organs. There are saturated fats, found in animal products, unsaturated fats, found in plants, and trans fats, usually found in processed foods. Micronutrients are nutrients needed in smaller amounts, but are important. Vitamins are organic compounds that serve various roles, like immune function, energy production, and blood clotting. Examples include vitamins C, D, E, and B vitamins. Minerals are inorganic substances required for functions like bone health, fluid balance, muscle contraction, and many more. Examples include calcium, iron, potassium, and zinc. Water is a critical component of nutrition. It aids in digestion, regulates body temperature, lubricates joints, and supports cellular processes. Dehydration can lead to fatigue, impaired cognitive function, and other health issues. So, what are the technical parameters in the science of nutrition? The science of nutrition involves various technical parameters that help assess the energy content of food, the body's energy expenditure, and how different nutrients are metabolized. These parameters are crucial for understanding the role of nutrition in energy balance, metabolism, and overall health, and guide nutritional recommendations for health promotion and disease prevention. They provide a framework for analyzing nutrition from an energy and metabolism perspective. These parameters include calorific value, respiratory quotient, basal metabolic rate, thermic effect of food, total energy expenditure, body mass index, glycemic index, glycemic load, nutrient density, and energy balance. The calorific value, or caloric content, is a measure of the energy provided by food. It is typically expressed in kilocalories or kilojoules. The calorific value of a food item is determined by the amount of energy released when the food is oxidized in the body. The calorific value of macronutrients is shown in the box given alongside. Fats provide about 9 kilocalories per gram. Proteins provide about 4 kilocalories per gram. Carbohydrates provide about 4 kilocalories per gram. Alcohol provides about 7 kilocalories per gram due to its conversion to acetic acid and subsequently to acetyl coenzyme A. But it is not a nutritionally beneficial source due to its disruptive effects on metabolism and potential for causing liver damage and other health risks. The respiratory quotient is the ratio of the volume of carbon dioxide produced to the volume of oxygen consumed during metabolism. It is used to infer the primary type of fuel being used for energy in the body. A respiratory quotient of about 1 indicates carbohydrates as the primary fuel source. A respiratory quotient of about 0.7 indicates fats as the primary fuel source. A respiratory quotient of about 0.8 indicates that proteins are being used as primary fuel source. Respiratory quotient helps in assessing metabolic processes, determining energy expenditure, and understanding macronutrient utilization during exercise or at rest. In diabetes mellitus, the respiratory quotient is less than 1, which indicates that utilization of carbohydrates is reduced and that of fats is increased. Basal metabolic rate is the amount of energy expended by the body at rest to maintain essential functions, such as breathing, circulation, cell production, etc. It is influenced by factors like age, sex, body size, muscle mass, exercise, fever, and thyroid hormones. Importance of BMR is that it provides a baseline for understanding total energy expenditure. It is used to estimate daily calorie needs for weight maintenance, gain, or loss. Basal metabolic rate can be measured by the basal metabolism apparatus during measurement. The person should be awake and at physical and mental rest. Temperature of surroundings should ideally be around 25 degrees centigrade. Basal metabolic rate is expressed in kilocalories per square meter surface area of body per hour for ease of calculation. Basal metabolic rate is taken to be 24 kilocalories per kilogram body weight per day for an adult. The thermic effect of food is the energy expended by the body to digest, absorb, and metabolize nutrients. It generally accounts for about 10% of daily energy expenditure. Protein has a higher thermic effect compared to carbohydrates and fats. Indicating more energy is used to process proteins. Relevance of thermic effect of food is that it affects the total energy expenditure and can impact weight management. Thermic effect of food is related to specific dynamic action, which refers to the increased heat production or metabolic rate following the intake of food. Specific dynamic action for lipids is around 15%. Specific dynamic action for proteins is around 30%. Specific dynamic action for carbohydrates is around 5%. And specific dynamic action for mixed diet is assumed to be 10%. Because of specific dynamic action, actual calories available from food is lesser than the theoretical calculation. Total energy expenditure is the total amount of energy expended by the body in a day. It includes BMR, thermic effect of food, and energy expended through physical activity. BMR typically accounts for the largest portion of total energy expenditure. Physical activity contributes varying amounts depending on the level of activity. Thermic effect of food or specific dynamic action also needs to be taken into account. Please pause here and go through the formula depicted below. It's easy to understand as to how the total energy requirement is calculated. Also note that the energy considered for physical activity depends on the nature of activity. As described previously, basal metabolic rate is assumed to be 24 times the body weight, and specific dynamic action is assumed to be a 10% extra requirement. Here, we have provided illustrations to make things easy for you. By using the formula as described previously, the energy requirement of a person weighing 65 kilograms, doing moderate work, has been calculated. Similarly, the energy requirement of a person weighing 55 kilograms, doing heavy work, has also been calculated. Please pause here and try to figure out these calculations. Once you understand, you too can perform these calculations with ease. Notice how the BMR has been calculated. Also note how the calorie requirement for specific dynamic action has also been taken into account as a certain percentage of overall calorie requirement. Body mass index is a parameter used to assess body weight relative to height. It is a simple way to classify individuals into categories like underweight, normal weight, overweight, and obese. Limitations of BMI is that it does not differentiate between muscle and fat mass, and it may not accurately reflect body composition in athletes or the elderly. The various body mass index categories have been shown here. A person is considered underweight is when the body mass index is less than 18.5. Body mass index in between 18.5 and 24.9 is considered as normal weight. A body mass index within 25 to 29.9 indicates overweight. And a body mass index equal to or above 30 definitely indicates obesity. The formula for calculating BMI is the weight in kilograms divided by the square of height in meters. The glycemic index is a measure of how quickly a carbohydrate-containing food raises blood glucose levels after consumption. It is useful for understanding how different foods affect blood sugar and can guide dietary choices for those managing diabetes or insulin resistance. It can guide dietary choices to maintain steady blood glucose levels. Foods with a low glycemic index tend to provide a slower, more sustained release of energy. Shown here is the glycemic index scale with common examples: high glycemic index, 70 or above; moderate glycemic index, 56 to 69. Low glycemic index, 55 or below. Foods with low glycemic index are to be preferred. The glycemic load considers both the glycemic index and the amount of carbohydrate in a serving of food. It provides a more comprehensive view of a food's impact on blood glucose levels. It helps understand the overall glycemic impact of a meal or diet. Foods with a high glycemic load may cause rapid spikes in blood sugar, while those with a low glycemic load offer more gradual increases. The glycemic load categories are depicted here. 20 or above is considered as high glycemic load. A glycemic load in between 11 and 19 is considered moderate. A glycemic load of 10 or below is considered low. You may go through the formula used to calculate glycemic load. Nutrient density refers to the ratio of essential nutrients, like vitamins, minerals, and protein, to total calories in a given food or meal. Foods with high nutrient density provide more nutrients relative to their calorie content. Examples of nutrient-dense foods include leafy greens, vegetables, fruits, lean proteins, and whole grains. Importance of nutrient density lies in the fact that it emphasizes quality over quantity in dietary choices. Diets rich in nutrient-dense foods are associated with better health outcomes. Energy balance is the relationship between energy intake, which includes calories consumed through food and drink, and energy expenditure, which refers to calories burned through basal metabolic rate, physical activity, and thermic effect of food. Energy balance outcomes include positive energy balance when intake is more than expenditure, which can lead to weight gain. Negative energy balance can result in weight loss. Maintaining a balance is crucial for sustaining a healthy weight. I shall now be sharing some relevant information about the proximate principles of diet and important aspects related to nutrition. The rule of thumb is that protein intake needs to be 1 gram per kilogram body weight for adults. However, requirement in infants, children, pregnant and lactating women, sports persons, is higher. Carbohydrates have a protein-sparing effect because when enough carbohydrates are present in diet, amino acids are not used as energy sources. A normal healthy adult is said to be in nitrogen balance because the dietary intake equals the daily loss through urine, feces and skin. When protein intake is less than excretion and loss, it is a situation of negative nitrogen balance. When protein intake exceeds excretion and loss, it is a state of positive nitrogen balance. What are the factors influencing nitrogen balance? And why positive nitrogen balance is required? To compensate for obligatory loss through skin, urine, feces. To provide proteins for growth in infants, children, adolescents. To provide proteins for essential functions, such as synthesizing enzymes, hormones, etc. To provide extra proteins as in case of pregnancy, lactation and convalescence. The biological value of protein is the ratio between the amount of nitrogen retained and nitrogen absorbed during a specific interval. Net protein utilization is a better index than biological value to denote nutritional quality and availability of a protein. Protein efficiency ratio is a measure used to evaluate the quality of a protein based on its ability to support growth. It is commonly used to assess the effectiveness of protein in promoting growth and development. Protein efficiency ratio is calculated by dividing the weight gain of experimental laboratory animals by the amount of protein they consumed during the study period. Chemical score of protein is a measure used to evaluate the quality of a protein source based on its amino acid composition compared to a reference standard, usually egg protein, which is an ideal or complete protein. It is one way to assess the nutritional value of a protein in terms of its essential amino acid content. A chemical score greater than 1 indicates that the test protein meets or exceeds the reference standard. What are limiting amino acids? Certain proteins are deficient in one or more essential amino acids. This amino acid is said to be the limiting amino acid. Limiting amino acid is that which limits weight gain when a protein is supplied to an animal. The problem of limiting amino acid may be overcome by taking a mixture of proteins in the diet. This is known as mutual supplementation of proteins. Pulses are deficient in methionine, but rich in lysine. On the other hand, cereals are deficient in lysine, but rich in methionine. Therefore, a combination of pulses and cereal will supplement each other and become equivalent to a complete protein. Please pause and check the tables shown here. The limiting amino acids in some common foods have been mentioned. Also go through the nutritive parameters of some common proteins. This is clarify matters for you. Fats provide a concentrated source of energy. A minimum intake of lipids is essential for absorption of fat-soluble vitamins and for providing essential fatty acids. Visible fat is the fat which is consumed as such. This includes butter, cheese, etc. Invisible fat is the fat present as part of other food items, and which is not apparent. Cholesterol has atherogenic effect and increases the risk of coronary artery disease, and therefore dietary intake should be restricted. Vegetables, cereals and pulses hardly contain any cholesterol. Saturated fats raise serum cholesterol, while unsaturated fats lower it. Therefore, unsaturated fats are to be preferred. The ideal fat intake is about 15 to 20% total calories, out of which about 25 to 30% may be polyunsaturated fatty acids. Polyunsaturated fatty acids are a source of essential fatty acids and also have cholesterol-lowering effect. Omega-3 fatty acids, found in fish oils, decrease LDL and VLDL levels in blood and so have an anti-atherogenic effect. Trans fatty acids are atherogenic because they lower HDL level and elevate LDL level. Trans fatty acids are present in dairy products and hydrogenated edible oils. Trans fatty acids adversely affect endothelial function and can aggravate insulin resistance and diabetes. Polyunsaturated fatty acids is considered essential, but excess PUFA may lead to production of free radicals that may be injurious to the cell. Ideally, PUFA should not be more than 30% of total fat intake. The fat content should be such that the ratio of saturated fatty acids, MUFA, and PUFA in the diet be equal. Cholesterol intake of more than 250 mg per day isn't advisable. Carbohydrates are body's primary source of energy. Foods high in complex carbohydrates, like whole grains, fruits and vegetables, also contain vital nutrients, including vitamins, minerals and antioxidants. Complex carbohydrates with high fiber content support healthy digestion and can help prevent constipation and other gastrointestinal issues. Ideally, carbohydrates should provide around 60% of total calorie requirement. Cautions to be maintained. Refined carbohydrates should be consumed with caution. They are bad. Added sugars are bad. Overconsumption of carbohydrates, even healthy ones, can lead to weight gain. Carbohydrates should be a part of balanced diet along with lipids and proteins. Whole grains like brown rice, whole wheat, oats are preferable. One should aim for high fiber by including fruits, vegetables, and legumes in the diet. Added sugars should be limited and food labels need to be checked. A range of carbohydrates has to be incorporated in the diet for balanced intake. Dietary fibers have immense importance in nutrition. Dietary fibers, often simply called fiber, are plant-based substances that the human body cannot digest or absorb. Although they don't provide energy in the form of calories, they play a critical role in maintaining digestive health, regulating blood sugar, and supporting heart health. Please pause and go through this list of various categories of food items, which have reasonably optimum or high fiber content. Dietary fibers are generally classified into two categories: soluble and insoluble. Soluble fiber dissolves in water to form a gel-like substance. Slows digestion and can help lower cholesterol and regulate blood glucose levels. Common sources of soluble fibers include oats, legumes, apples, citrus fruits, and psyllium. Insoluble fiber does not dissolve in water. Adds bulk to stool, aiding in regular bowel movements and preventing constipation. Common sources include whole grains, wheat bran, nuts, and vegetables like carrots and celery. Health benefits of dietary fibers include digestive health, heart health, weight management, reduced risk of certain cancers, and blood sugar regulation. The recommended daily intake of fiber varies by age and sex. Adults men may require 38 grams per day between ages 19 to 50, and 30 grams for those aged above 51 years. Adult women may require 25 grams per day between ages 19 to 50, and 21 grams for those above 51 years. Requirement in children varies by age, with general recommendations for fiber intake increasing as children grow. Fruits and vegetables are essential components of a healthy diet, offering a rich source of vitamins, minerals, antioxidants, and dietary fibers. They play a significant role in supporting overall health, reducing the risk of chronic diseases, and promoting vitality. They are generally low in calories and high in essential vitamins, minerals, and fibers. Go through the table shown here and learn about the importance of various categories of fruits and vegetables. Please pause here for a couple of minutes and go through this table. I am sure you would find it quite informative and helpful. I shall now be sharing few additional information about certain aspects of nutrition. A balanced diet rich in various nutrients can help prevent chronic diseases like diabetes, cardiovascular disease, and certain cancers. Proper nutrition also supports immune function, reduces inflammation, and promotes healthy aging. To achieve a balanced diet, the following guidelines may be considered. Variety: consume a wide range of foods to ensure adequate nutrient intake. Moderation: control portion sizes and avoid excessive consumption of high-calorie, low-nutrient food. Balance: include appropriate amounts of carbohydrates, proteins, and fats. Adequate intake of micronutrients: ensure sufficient intake of essential vitamins and minerals. Technical points to be considered when preparing a balanced diet. Macronutrient balance: ratio of carbohydrates, proteins, and fats should ideally be 45 to 65%, 10 to 35%, and 20 to 35% respectively. The other key points include: prioritize whole, minimally processed foods, include variety, adequate fiber intake. Choose healthy fats and limit unhealthy lipids. Minimize added sugars, Control portion size to avoid overeating. Adequate hydration. Composition that includes proximate principles and other micronutrients. Special dietary needs to be considered, such as pregnancy, illness, allergies, activity, etc. Regular review and adjustment so as to meet nutritional needs and health goals. The application of nutritional knowledge has far-reaching implications in healthcare and public health. Nutrition plays a key role in preventing and managing chronic diseases like diabetes, cardiovascular diseases, obesity, and certain cancers. Medical nutrition therapy involves the use of specific dietary interventions to treat or manage medical conditions such as diabetes, hypertension, and gastrointestinal disorders. Clinical dietetics focuses on individual dietary needs, often in healthcare settings, where dietitians work with patients to develop and implement nutrition plans. Sports nutrition concerns nutrition strategies to enhance athletic performance, recovery, and injury prevention. So, how do we assess nutritional status? Assessment is a critical step in dietetics. It involves evaluating a person's nutritional status through various parameters. Dietary assessment, collecting information on food intake, eating patterns, and dietary preferences through food diaries, recalls, or questionnaire. Anthropometric measurement, measuring body size, weight, height, and body composition to assess nutritional status. Biochemical tests, analyzing blood, urine, or other body fluids to determine nutrient levels and detect deficiencies or imbalances. Clinical assessment, observing physical signs of malnutrition or nutrient deficiencies. Medical nutrition therapy is a specialized approach in dietetics that uses dietary interventions to treat or manage specific medical conditions. It involves creating customized diets to meet therapeutic goals, such as reducing blood pressure, managing diabetes, or supporting weight loss. Medical nutrition therapy also uses nutrition to help manage chronic conditions like cardiovascular diseases, kidney disease, or gastrointestinal disorders. Nutrition education and teaching patients about their specific dietary needs and how to make healthy food choices is a part of medical nutrition therapy. In summary, nutrition as a medical discipline is complex and multifaceted, with significant implications for individual and public health. It plays a critical role in disease prevention, health promotion, and personalized medical care. As you delve deeper into this field, you'll discover the profound impact that nutrition can have on overall well-being and quality of life. The principles of dietetics center on assessing nutritional needs, developing personalized nutrition plans, and promoting health through diet and lifestyle changes. Dietitians play a pivotal role in healthcare, offering evidence-based guidance and working collaboratively to improve patient outcomes.
Thanks for watching this video. Our next tutorial in the Medical Biochemistry Power Capsule series is titled, Applied Nutrition. The tutorials presented in the MBPC series are not intended to be a substitute for your textbooks. However, we feel that these tutorials can prove to be very valuable as complementary educational aids and for purpose of rapid revision prior to exams. If you have enjoyed this video, don't forget to hit the like button, subscribe for more exciting content, and share with your friends. And do keep watching our channel to remain ahead in the game.